Good morning, everybody. I'm Randy Barber, the Chief Communications Officer for the Boulder Valley School District. I apologize that we're starting a few minutes late, but what I do want to welcome you to our first ever, our inaugural weekly Wake Up, which is an opportunity for employees to be able to ask questions directly on issues that matter in our school district. This morning, I'm very proud to have quite the panel of folks to answer questions in regards to COVID-19 and our return to school this week. And so I'm going to just get straight to it. I've got on our team Chris Breck, who is in our academic world, helps to coordinate so much. We've got Margaret Crespo, one of our area superintendents, Mike Grados, who is our assistant superintendent of HR. Rob Price, the assistant superintendent of operational services. Robin Fernandez, another area superintendent. Sam Messe, area superintendent. Stephanie Farron, who is our Director of Health Services, and then Terry Mulford, who is our Boulder Valley Education Association President. Additionally, we have a number of folks from Boulder County Public Health joining us and Broomfield County Public Health, and I'd like to go ahead and have them introduce their teams. We'll start with Susan, Helene from Broomfield. Good morning, Helene.
Good morning, everyone. Thank you for letting us join your meeting this week. We're very excited to work with everybody joining back to school in-person classes. So my name is Helene Lanzer. I'm the Public Health Nursing and Epi Manager for Broomfield Public Health. And myself and my couple of people on my team are going to be available to help the schools that are in Broomfield. And we work very closely with BVSD and Boulder County Public Health. Thank you.
Thank you, Helene, for being here today. And then Jeff Zayak is the Executive Director of Boulder County Public Health. Good morning, Jeff.
Good morning, Randy. Good morning, everyone. We're excited to present to you some of the latest data that we're looking at today, and I'll let the rest of my team introduce themselves.
Hi, Chris Urbina. I'm the Medical Officer for Boulder Public Health and Broomfield Public Health.
Hi, I'm Emily Payne, epidemiologist and surveillance co-lead for Boulder County Public Health.
Hi, I'm Heather Crate. I am the Education Liaison Officer for our COVID response.
Okay, I think that mostly wraps it up here. Emily, I think you're going to present a little update to us so that we kind of know where we stand today. Is that correct?
Yep, I have a PowerPoint. I will get it up right now. I don't usually present on Google Meets, so please give me a second to figure it all out.
Of course, thank you.
Okay. Okay, I think I got it now.
We can see you.
Okay. You can see the PowerPoint too?
Yes, thank you.
Great. Okay, well, thanks everybody for coming today. So I'll just be presenting an update on our latest data. This data is mostly through the end of the day on Saturday. We usually take till around midday, like for example, midday today to get our data through end of the day yesterday. So this is our most complete data. Okay. So this graph shows the number of Boulder County residents and those who are CU affiliated who were newly reported as a positive case or who are considered a probable case to date. You'll see that those who are affiliated with CU are in the light blue. Largely over the past couple of weeks where we've been having this higher number of cases, the majority of them have been affiliated with CU Boulder. We have seen some recent upticks in case numbers among those not affiliated with CU Boulder. For example, you'll see on the 22nd, we had 39 cases among those not affiliated, and on the 24th, we had 35 among those not affiliated, which are a little higher than we've been seeing lately. This graph shows our cumulative COVID incidence over time by age group. So you can see there in the blue, or I'm sorry, the green and the orange line, we're seeing the highest case rates by far among those 18 to 19 and 18 to 22-year-olds. Not shocking, as I mentioned, we're seeing most of our cases among those affiliated with CU Boulder, particularly students. But we have seen this sustained upward trend kind of going since around the 1st of September. So that's kind of what we've been seeing. You'll also see all the rest of the age groups down there. However, they're pretty squished due to the fact that these rates among the 18 to 19 and 18 to 22-year-olds have been so high. So I'll show you another graph in a minute that looks at those age groups in a little bit closer detail. I also wanted to mention the incidence among the 18 to 19 and 18 to 22-year-olds has really been driven by those who are CU students. So you'll see again in the blue there and orange, the high rates among the CU Boulder students and the lower rates among those who are not affiliated with CU down at the bottom. This next graph is what I was just mentioning about the rates among those other age groups that were all squished at the bottom. So when we look at it a little bit more closely, because those rates were so high, we do see some different trends going on among these different age groups. So again, although the rates are dramatically higher among the 18 to 22-year-olds, we might be seeing some first signs of a wider transmission to different age groups going on in Boulder County with these trends. All other age groups besides 18 to 22 have also seen increasing case rates over the past week. The increase among 18 to 22-year-olds preceded the upward trend that we're seeing among the other age groups by around 5 to 10 days. So these trends upwards started, around 2 weeks ago, we can kind of assess at this point. So particularly in the past 7 days, we've seen increases among each age group on this graph. Those 0 to 9 have gone from a 20 per 100,000 to 40 per 100,000 case rate. 10 to 17 has gone from 58 to 128. So both of those age groups more than doubled, although their rates are still very low comparatively to the 18 to 22-year-olds. 23 to 29-year-olds have seen maybe the most sharp upward increase. That's the line there at the top. They've gone from about 121 per 100,000 to 186 per 100,000 new cases in the past week. We've also seen some trends upward among the 30 to 54 who have gone from 62 to 112 per 100,000 in the past week. Really good. The one thing that we're seeing here is the gray line down there toward the bottom. Those who are 55 plus, who we know are at most risk of the severe outcomes of hospitalization, ICU, or even death, have only increased from 33 to 44 per 100,000 over the past week. And I think that's why we're not seeing as sharp of an increase or much of an increase in hospitalizations, because the folks who are seeing this upward trend are at lower risk of those severe outcomes. I also want to talk about our percent positivity. So this is when we take every COVID test that comes back through our electronic lab reporting that is positive and kind of divide that by all of the different tests that come back, both positive, negative, and inconclusive, which is not many. But this data is through 9/21. We last updated it last week, and there's a little bit of a lag. So this is kind of the most complete data. So we have a 5-day rolling average here to allow for easier interpretation of the trends. And we can see that percent positivity has been trending upward over the last 2 weeks and has now risen above 5% in this 5-day rolling average trend. It is at 6.7% positivity as of 9/21, which is, like I mentioned, our most complete data that we have at this point due to that lag. This is up from 3.4 last week. So that was a bit of a sharp increase, which you can clearly see in the graph there. The percentage over the past 10 days has ranged from 1.9% positive to 9.1% positive. So there's a lot of fluctuation, which is really why this rolling average helps to kind of show those trends more clearly. As I mentioned previously, we're not seeing as concerning things going on with hospitalization. So among our cases in Boulder County, we've had a hospitalization rate of about 64 per 100,000 over the whole course of the COVID-19 situation. That is less than half of what they've seen across the state in terms of rate per 100,000, and also much lower, almost a third of 3 times lower than what we see at the national level with 175 per 100,000. So that's really good news. This graph shows our current hospitalizations in Boulder County. we have seen some increases. You can see there an upward trend over the past couple weeks or week or so. We're currently, as with our most recent data that we have on our dashboard, at 15 people hospitalized as of 9/25. We'll update that dashboard again this morning and are keeping a very close eye on this indicator for sure. I also want to mention the trends at the state level. So I know that this is a really small graph. There's a lot of numbers. Just ignore the numbers and just look at the line. So our hospitalizations have been slowly trending upward across Colorado. And currently we're at 177 people hospitalized for confirmed COVID, which is compared to about 150 people a week ago. So that is an upward trend. It's not dramatically upward, but it is increasing. It's something to keep a very close eye on. I know Jeff presented on this at the school board meeting last week, but I'll just recap very shortly and say we are doing a mask monitoring and social distancing monitoring project. We're doing that each month. Our data for September is going to be coming out very shortly within the next 3 days. But right now, our results from August are what we're showing here. We're seeing really good compliance in businesses with masking, which is really good news. We know that that's critical, along with social distancing, keeping up with the hand hygiene, et cetera, for really keeping our case rates down. And I think I attribute a lot of this, we have been at a much lower rate than most of the state for the large portion of COVID-19. And I think the compliance with masking and our community's uptake of these strategies really has been a core reason for that. So I'm just also going to briefly go through some guidelines. Jeff also presented on these last week. I have a few data points that have been updated, but we actually update this on Tuesdays. So this is some data from last week, but it's still good to show. These are some of the indicators that are being monitored by leadership to assess where we need to go in terms of the situation with schools reopening. So this first indicator is our case rate per 100,000. This is a 14-day case rate. And in Boulder County, with our data through last week, we were in the red zone. I can confirm, looking at our data through early this week, we are continuing to be in the red zone due to the surge we are seeing, largely attributed to CU students. In Weld County, they were also in the yellow level, getting pretty close to the upper edge of the yellow level when we got the data from them last week. And also Broomfield is at the yellow level with 62.2 per 100,000. When we look at our trends in case rate over the past couple of weeks, Boulder County was also in the red level for that. We saw, of course, as you all know, that really dramatic uptick. So compared to the previous 2-week period, the most recent 2 weeks has seen about 280% more cases. And again, this will be updated tomorrow. I don't expect that number to dramatically fall. Weld County has also seen some more cases, just over 25%. So they're just into the yellow. And Broomfield is also into the yellow with 37% more cases in the past couple weeks. Our positivity data, and again, I'll mention this is through last week, but we actually are still in the green. So when I showed you the previous graph, that's using a 5-day rolling average. However, at the state level, the indicators look at a 14-day average, so it smooths that even more. And we're currently at 4.5 with this 14-day average, but last week, and comparable with the other counties, we were at 3.5. Weld County was at 3.8 and Broomfield was at 2.3. Our goal is really to stay below the 5 level, and our indicators here also, I want to mention, are more strict than what is seen at the state level. And we really did that because we saw a really long period where we were remaining quite low. So that's just something to keep in mind. I also wanted to mention a couple indicators that are additional metrics. Those first 3 are really the core, but these additional metrics also help to inform decisions. So we're looking at trend in case rates, but among specifically school-age children 5 to 17. You'll see here that the other counties are still in the process of changing over to this. I was reminded by one of my colleagues at Weld County, we are able to look at individual age year populations, which I had totally slipped my mind. So we were able to really confine this to those that are school age children to look at what's going on among them and not have that be influenced by those who are in college. So among 5 to 17-year-olds in Boulder, we saw a decrease actually comparatively to the previous 2 weeks of 8% in cases. This might change this week, but I don't expect it to be too dramatic. In Weld, they saw a small increase among 5 to 18-year-olds of 9.5%. And in Broomfield, they did see a large increase, but they are working to shift over to that 5 to 17 rather than 5 to 19 so that we can figure out whether that actually is among college age people or if it is among the children. Our last indicator that we look at is our internal capacity to do case and contact investigation. So our data as of a couple weeks ago, this will definitely be updated tomorrow because we were able to assess this for more recent dates. We were at about 70% of our cases and contacts being able to follow up within 24 hours. Weld County is working on this metric. They don't currently assess this at this time due to some data system constraints. And Broomfield was in the green level with 90% of cases and contacts followed up within the 24 hours. I also wanted to mention there's all of the indicators that were mentioned earlier: hospitalizations, testing results within the district, what's going on with the community spread, what's going on in terms of inside the school and their ability to cohort, how big is the school, and availability of testing, in addition when these decisions are being made about reopening. We also have important considerations about what is going on in terms of the case rates, whether it's contained to a specific geographic area or a specific group, and what's going on with our other indicators when we're assessing school reopening. So that's the end of my data presentation. I'll go ahead and stop sharing my screen now.
Excellent, Emily. Thank you so much for getting us up to speed on where we stand today. And I know that we've got a great number of questions, so I think we're going to probably jump straight to that. And what we had thought about doing was having Terry Mulford, our president of the BVEA, start by kind of like the first pitch in baseball, starting with the first few questions that they've heard a lot of from teachers. Terry, do you want to go ahead and step in? Oh, and actually, before I do that, sorry, let me do one other thing here. Sorry, totally inartfully here. I'm going to just present my screen for 1 second, just so that we can kind of be prepared on the back end. We did want to mention that we are accepting questions today. If you have questions, you can just go to bit.ly/BVSD-WakeUp, and we've got the form that we sent out to everybody in the email. You can also go back to your email form as well. But if you've got questions as we're going through today and want to add those in, feel free to do that. And I will toss it over to you now, Terry. Sorry about that.
Thank you, Randy. I appreciate the opportunity to be here today and to present some of the questions that we're hearing from our members. And some of these questions were touched on during Emily's presentation, so I apologize if it seems redundant, but I think our members would appreciate hearing the answers. So the first question I'm going to ask is it safe or not for people to be back in buildings considering the alarming current COVID case trajectory in Boulder, and why are CU numbers not included in the COVID count?
So I can speak to one thing on the data side, the CU cases, they are included in our counts. We do assess them. They are residents of our county. So any data you see on our website, any of our graphs will include those students.
Okay.
And Terry, I can answer the second half of that question. I think all the precautions that Boulder Valley School District has put into place reduce the chance of getting an infection. And I think we can go over those just briefly. You know, masking, hand washing, physical distancing, the increased ventilation, the screening prior to coming into the classroom, and the whole host of other recommendations that the schools have put in and decrease the likelihood of having spread and infection, even though we have an increase in number of college students on the CU, often on campus. I think there is no safe place, whether or not you live in where you're going to schools or any place in the community. I think if you take those recommendations that we've talked about, I think you're going to decrease the likelihood of you getting the infection or spreading the infection to others. And I'm sure that question will come up again, Terry, and I'll try my best to answer it again.
Thank you very much. All right, our next question. If our numbers give us a yellow, green, green, red, yellow, what does that mean in terms of district action? Has the district devised a plan for how these 5 metrics interact and then inform decisions?
And Jeff or Boulder County, would you guys like to start kind of by talking about how you guys form up your recommendation, and then maybe we can answer on the back end of it as well?
Yeah, so the recommendations are formed from a whole host of things, those three top indicators as well as the additional indicators. And in addition to that, the things that Emily covered in those last two slides. So as an example, we can't just take a chart and say, if it's all green, we're going to do this, or if it's all yellow, we're going to do exactly this, because we have different situations that are occurring depending on the situation that we're in. So a great example of that is, I'm going to give you sort of an extreme example where we may have a really high incidence rate because we have a large outbreak in a jail, as an example. That outbreak is confined to that facility and has very little impact or potential for impacting the rest of the community. So just because we have one of those indicators out of that that green or yellow box and in a red box doesn't mean that we still can't move forward with a recommendation to be back in school. So with the University of Colorado example, the reason that as we've been presenting to you, we've been so focused on looking at are we seeing transition of community spread to other cases in the community, is because that's an important consideration for us to be looking at. We are looking very closely daily at those trends that Emily just presented. And in our case investigations and contact tracing, we're determining if we know that the spread into the larger community is happening from a CU student, or if that is a generalized trend in the community that we need to be paying attention to. So all of those kinds of things together are really important considerations when we make a decision on where we think we need to be with schooling, and it's really difficult to just draw parallel conclusions based on where somebody is in that chart. And as a comparison, many other school districts across the state just use the chart as guidance. So they haven't even drawn recommendations as clearly as we have in some of these categories. So it's intended to be a guide in decision-making tool for us, and that is how we're using it with both of our school districts and with both superintendents. So each time we see data in these areas, we will be sure to make sure that we're talking with our superintendents and with their staff and making judgments based on our chief medical officer's perspective, Dr. Chris Urbina, who you just heard from, as well as with the superintendents themselves.
Thank you, Jeff. We'll go and go to the next question, Terry.
Okay. I think teachers are really wondering about this guidelines for social distancing in their classrooms. So what would determine 3 to 6 feet versus 6 feet social distancing being safe?
Terry, I can try to answer that question. The challenge for us is, as we knew early on in this disease process, we didn't know how this would spread. Now we're fairly clear that we know it's small droplets, large droplets, and the idea behind wearing a facial covering, 2 to 3 layers of cotton, is a good idea. And then adding to that physical distancing, from 3 to 6 feet. We believe that 6 feet is better. Obviously, and the greater the distance, the better, and that's why we were encouraging outside classrooms where possible, safe walking places within schools. Any kind of physical distance we can increase is better than not. But I think it's important to put this in perspective, as we were talking about a little bit earlier. It's the complete package of prevention strategies, not just physical distancing, that's important. So facial coverings, physical distancing, mechanical ventilation, cohorting students, outside activities as much as possible. All that helps reduce the amount of spread that we have. Now, there is increasing evidence that there is some aerosolization of the virus, but I do think that all the things that we're putting into place will mitigate that and try to reduce the spread. So there's no exact number that I can give you that is safe. But I think we can reduce the risk. And finally, the screening that we're doing before students come into school is an essential piece of this. If kids are sick, if staff and teachers are sick, they should not be coming to school. And I think that's very important. If you're having symptoms, obviously you can spread, if it's a virus, whether or not it's COVID-19 or any other virus, we want you to stay home and get evaluated. And I know either Soda or Heather can comment on that as well, or Stephanie, but I do think that's important that we screen our kids out so that the kids and parents and teachers can stay home if they're sick. And again, that reduces the amount of transmission of COVID-19 or any other infection.
Thanks, Chris. I think I would add too is that we're trying to support school districts in finding a balance between academic and social emotional learnings and a strict adherence to a 6-foot social distancing. There's a guide from the American Academy of Pediatrics that talks a lot about that. And we are seeing some countries be able to successfully reopen schools while using 3 feet of social distancing without seeing increases in community spread. And so I think it's really trying to balance all of those pieces, as Dr. Urbina spoke about, with the ways that we're trying to prevent infection. So just add that piece.
Terry, did you have another question?
Yes, I do. How concerned do we need to be considering that cases will continue to rise as the weather gets colder and inevitably staff and students will get sick? So I think we're concerned about just the normal flu season that is approaching us, as well as the COVID numbers.
Chris, do you want to take that?
I don't want to steal the entire spotlight, but so anybody who would like to add to this, I'm happy and open to do that. I think probably Terry, again, good question. We're all concerned about the overlap of flu season with COVID-19. So I would encourage anybody who can take the flu shot to get the flu shot. Now is the time, end of September, early October, get your flu shot. That will reduce the likelihood that we will have as much flu in the community as we possibly can. And I think this is a very important reminder that the same precautions that we're using to prevent COVID-19, wearing a face covering, washing your hands, physical distancing, staying healthy, get plenty of rest, not smoking, do all the things that keep you healthy, will also reduce the amount of infections of other diseases in our community. So yes, when we're closer together, then that's where the usual flu season comes in, other respiratory infections come in. But I think if we do all of these things, we will have a safer environment for everyone in schools and out in our community by reducing the spread of all infections. And as your mother told you, you should be washing your hands and not touching your nose, eyes, face periodically, because those respiratory viruses occur that way. We don't think that's true of COVID-19, but all those other respiratory infections. If you have the sniffles, if you cough or sneeze, use a disposable tissue and then throw it in the trash, and then washing your hands. Those are very good recommendations to reduce the spread of respiratory infections other than COVID, and they will help with COVID. So there's lots of overlap in infections, and there's lots of overlap in prevention. I'd welcome any other additions that people would like to say as well.
Okay, Terry, did you have anything else that you wanted to ask?
I think we've covered the questions, and I just want to tell Dr. Urbina that I did get a flu shot about 2.5 weeks ago. So trying to be preventative. All right, I think that's it. I appreciate the opportunity to share these questions from our members.
Awesome. Thank you for the first questions, Terry. And just want to say thank you for the partnership that we have with BBEA as we try to work through all this. I'm going to go ahead and dive into the questions, and I know that they're coming in fast and furiously online. Again, the link for that is, pull it up here. It's bit.ly/BDSD Wake Up if you have a question as we're going through here. A question for Boulder County Public Health. This came from a teacher over at Crestview. Can children under 10 years old, assuming that they may be asymptomatic, transmit coronavirus to adults? I would assume yes, but are there studies to show that they cannot transmit the virus? And I think that's something that's going around on social media right now, that kids are less likely to transmit it. But we're hearing that that's not the case, correct?
Heather or Helene, can you take that?
This is Helene from Brimfield. So there is, as Dr. Urbina already shared, we're learning a lot still about this virus. And so we are being very careful of paying attention to what age groups we see at risk. We do feel like there is a lot of literature supporting that the younger age group has much more mild symptoms, and we're not seeing as much transmission and secondary transmission. And we're looking at a lot of studies happening that have happened in other countries across the world. So we're very hopeful that there's a lower risk, but there's not no risk. And so that's, again, will sound like a broken record, but it's why all of those things of just proper use of masks, making sure that the mask is covering the nose, not just sitting under the nose or down at the chin, those types of things, and the distancing and hand washing, all of those things play a part in everything. But we do see milder symptoms, and we do see less occurrence of transmission, and I'm not sure if anyone else wants to add anything more.
Okay, I'm going to go with it. That was a good answer. So similarly, how is it possible to be 100% asymptomatic? Most people can tell when they're coming down with an illness, right? Is what the teacher wrote. Anybody want to add in on that one?
I can. It's a very common occurrence. Every morning, my voice is a little rough this morning, and that just happens. And so people consider that a normal process of waking up. So they may not report their symptoms when we do go back and do contact tracing and interview people who have been sick. So they may say, "Oh yeah, I guess I did. I didn't feel that well that day. Oh yeah, I guess I did have a little sniffles." And so generally, they're not 100% asymptomatic. They may have small symptoms that they may not recognize as a symptom of a disease process like COVID-19. And so that's very, very common.
And I know that we got a number of questions from teachers. I'll start with this one here. What happens if my child gets sick, with a fever, not necessarily COVID, which I think is the hard part about this, is that it's a little hard sometimes to tell if it's COVID or not. Do I have to stay home the whole time? I know that we had teachers that were asking about, and I think this might go more to our team for an answer in regards to kind of the way that we'll play these with employees. But, if they're not feeling well for this, for today, but they're not feeling sick enough to necessarily be completely off, they don't want to take their sick leave. Mike Rodis, do you want to start with I think the answer from Boulder County Public Health is if you are showing symptoms, don't come. Right, Chris?
That's correct, but I'm going to turn this one over to Stephanie, Helene, or Soda if she's on the phone.
Okay, and then I'll just add a second part of that once you guys are done with your answer to that, the question I think then goes to our team in HR about how we want to handle, people that are being sick. And I think part of the answer is that we hope that they will continue to work just virtually and how that might work. So I'll go ahead and turn it over back to your team, Chris.
Soda, are you on the line?
So
doesn't sound like it. Helene, do you want to take that?
I'm sure I could speak to some of it, and I think Stephanie, were you going to go? Go ahead.
I was just going to mention that there is a pretty complex algorithm that we follow as far as sickness. But you're right. The first thing we want you to do is to stay home. Basically, if your symptoms resolve in 24 hours, you can come back. If they last longer than 24 hours or up to 48 hours, then we want you to call in, talk to one of our nurses that are working with staff illnesses to determine whether it's something that we can watch for a little bit longer, if it's something that we need you to go and take a COVID test. But there are major symptoms and minor symptoms that we look at, length of time. The one thing I do want to mention is that, we know, especially right now with all of the fires and everything that's been going on, we've had a lot of people that have been reacting to those, the air quality. And of course, fall, there's, can be some really terrible allergy seasons also. One of the things that we really want folks to look at and think about is, are the symptoms new and unusual? If they're symptoms that you always have every year when you start back to school, allergy symptoms, from some of the pollen that's in the air, something like that, that would not be necessarily considered new or unusual for you. But call one of the nurses that are working, or your COVID coordinator that's working, with staff issues, to determine whether it's something that you can come back to work with, or if it's something that we need you to follow a little bit more closely. Everything is kind of nuanced right now, but we have lots of staff that are available to help work through those issues.
Perfect. Anybody else have anything to add on that one?
Just say a little bit more to the symptoms. So the symptom screening, as everyone has shared already, is so critical. So we really are counting on, parents reporting correctly, staff as well, staff, teachers, everyone. Like we said earlier, please do not come to work if you are sick. But in terms of the symptoms, loss of taste and smell is something that's kind of unique to COVID. So that's definitely a standout in terms of we definitely would be pretty suspicious of COVID. It doesn't mean it's always COVID, but definitely curious of it. But we see a lot of mild symptoms. We don't always see a lot of fever. So I just always think that's important to know that about 50% of cases may have a fever, but we do see some mild symptoms like headache and fatigue and runny nose, congestion. So, and sometimes, a lot of times there's an initial GI symptoms as well. It can be diarrhea, vomiting. So just being aware of a lot of the symptoms, which unfortunately look a lot like a lot of flu and other symptoms. So just, that's what, as Stephanie shared, we're trying to strike that balance between, if it's 24 hours, not needing to come back, you don't need to go in additional testing. But if it lingers longer, especially if it's going on longer than 48 hours, then considering getting COVID testing is definitely something worthwhile.
Awesome. Thank you, Helene. I know that we've addressed this to a certain point already, but a teacher asked the question of, with 709 new cases Friday, 584 on Saturday, et cetera, high counts elsewhere. Are we really starting school at the height of a pandemic in our community? So again, to either of our public health guests, in regards to, we're really looking at all the community, but that university side was what we sort of saw in a pocket, not a lot of community spread. That's kind of what's primarily putting us down this road currently, correct?
I'm happy to start that off and then open it up to anybody else who wants to comment. So yes, we definitely, the biggest challenge that we've seen is very specific to our university students. And at this point, we don't have any confirmed community spread, but as Emily just presented, we are seeing some increases in those other age groups. So we are going to pay close attention to that. That is pretty consistent with what we're seeing across the state as well. So if you looked at the state case data and the graph that they have right now, you'd see that same up spike in cases across the state. So we are paying close attention to that. At the same time, we are still seeing very low hospitalizations. Our positivity rate is still in the green. And we are starting to see decreases in CU cases over the last few days. So we will be continuing to watch that. And obviously, I think people have probably followed the media. We have an order in place between our self-quarantine request and the order that we have in place. We do believe that we're going to see decreasing cases. We are starting to get less referrals from the CU testing into Wardenburg, as an example. So as we see those things go down, our rates will come down as well. So my hope at this point is that we've been at the height and we are now on a decline, and we'll continue to see that decline as we move through this order process. And I'll see if anybody else has anything to add to that.
Jeff, I'd like to add that hopefully the success will continue on the CU campus. We've been working very closely with the leadership there and the city and county of Boulder to focus in on the significant increase in college-age kids that are coming down with COVID and the spread there. And I think that appears to, we have a strategy for that, and we're going to continue to work very hard to try to make that work. But I do think from a school perspective, that we need to focus in the schools on how best we can prevent the spread of infection within our school systems. So collaborating with all of you as administrators, staff, parents is critical to our success in preventing the spread at the school level. So I look forward to that continued partnership, that we can work collaboratively to prevent the spread. And now we're trying to mitigate the spread now at the CU campus. And hopefully all of that will work together. And so we'll have a safer community that we all truly have a responsibility for.
Awesome. Thank you. Thanks, Chris. We've gotten a number of questions that are along the same theme. I'm going to read one of them, but I think it has generally to do with how many adults can interact with kids. This specific one came from Angevine Middle School, where they asked, what are the protocols for passing period, bathroom use, lunch, etc.? How many adults can interact with kids on a daily basis? How many kids can interact with an adult on a daily basis? And I know that looking at some of the other questions that we've gotten, the idea, I think early on, and one of the things that we've talked about is that, and I think Chris and Jeff and everybody in public health have kind of mentioned this in one way or another, but the idea that, time in a pandemic seems to, go very quickly, that something that was kind of a rule of thumb, back in May, most certainly has changed by now. But the idea that 4-person was kind of an early idea. Stephanie Farron, do you want to start with kind of where we stand right now with the way that we're going to work with adults in our classes?
I think that I will let either Margaret or somebody else address that, because I think it's a broader picture, if that's all right.
Okay, sorry about that.
That's all right.
Good morning. So I can share a little bit. You're absolutely right, Randy. When we first started, we were following protocols very tightly, making sure that we were able to identify contact tracing very clearly and carefully. And as we've gotten continued guidance and following up, we're trying as much as possible, to Dr. Urbina's point before, to make sure that we have all of those mitigating opportunities and factors in place. Some of you remember that the high school schedule has that block piece to kind of limit that interaction. But at this point, it's not necessary to keep it at that level of tight. We've got lots of support services people that can interact with students on a regular basis. We want to make sure that there's hand washing and masking and things like that. But the current system that we have allows for that. And therefore, we don't need to keep that constant contact component to a number. We just want to make sure that when we've got protocols in place, so that when staff or students are interacting, we're able to go back and say who you were with, how long were you with them, what does that look like, similar to the protocols that we use among our adults that we've been using since we came back, as well as with our athletic programs. And then I'll hand it off to whoever wants to add in there.
Okay, not hearing anybody putting up their hand to do that. I know that, sort of the follow-up question there was the idea of being able to have specials teachers or those that kind of push into classroom support, be account, but if they're under 15 minutes. So again, the idea of the 15 minutes is really when we consider somebody a contact, right, Stephanie?
Yes, the CDPHE has very specific outbreak guidance. A close contact is somebody that's within 6 feet, longer than 15 minutes. We anticipate that, like Margaret mentioned, because we have classes staying together, right now we would have to look at that whole class as a group if there was somebody that was, unfortunately confirmed positive in that group. But 6 foot, 15 minutes or more, and pretty lengthy conversations and things like that.
Okay, very good. I know that we've gotten quite a few, questions in regards to filtration. So I was going to bring up Rob Price. Specifically, this one has to do with Fairview High School. They're wondering why that one specifically hasn't been upgraded, but others are kind of just asking general questions in regards to how filtration has been improved, knowing that that's an important aspect of keeping kids safe in this environment.
Yeah, Randy, I'll talk a little bit about what everybody else has emphasized on this call, right? We're taking a layered approach, and filtration or ventilation is one key component of that. So just as important as masking, washing our hands, staying home when we're sick. So what we have done is we've been following ASHRAE's guidance through this. If you look at a lot of the studies, they're recommending that. ASHRAE stands for American Society of Heating, refrigeration and air conditioning engineers. And what they have said is install filtration at the highest level. They've made a recommendation of MERV 13. The problem with MERV 13 is our systems weren't designed for that. So it restricts our airflow so much, we're not able to get the air changes that we're looking for in our building. So what we're doing right now is we've increased ventilation up to 100%. When temperatures allow, of course, if it's 95 degrees and you're bringing in 100% fresh air, you start bringing in extremely hot temperatures, right? So we're monitoring that. So we've increased the filtration to as much as we can. In many cases, that is a MERV 11. In other cases, it's only a MERV 8 filter. But really, what we're doing right now is we're watching carbon dioxide levels within our buildings. And that tells us that we're not bringing in enough fresh air if carbon dioxide levels reach a certain limit. So we've got a number of parameters. I mean, the thing is, you know, classrooms get hot and stuffy. I mean, that kind of tells us that we might not be bringing enough fresh air into that room, and a work order needs to be submitted. So teams have done a fantastic job going through, doing preventative maintenance on our systems, making sure that systems are functioning as we're designed. We're continuing to monitor those building automation systems that we have in our schools. But, you know, that's where we're currently at and feel comfortable with that layer of our approach.
And I think it's fair to say, I mean, obviously during our bond projects, we've been working to upgrade our HVAC systems, but that's a new HVAC system is a fairly expensive venture. So that, you know, in a time of fiscal tightness, you know, the idea of just replacing everybody's HVACs are not really a possibility, correct?
That is correct, yes.
All right. Next question in regards to passive screening. We've actually gotten quite a few questions in regards to this. You know, people wondering why we aren't doing active screening, whether or not BVSD will be, this is a specific question that came in from the IT department. Will BVSD be providing thermometers to screen visitors and employees? Rob Price, I know that we looked at, I'm going to make this a multi-answer thing, but Rob, if you can kind of talk about the fact that we looked at active screening, that we've gone with passive screening, then maybe public health partners to talk about how this has worked out in other places, because we know that, that passive screening is working.
Yeah, I think the key to passive screening, Randy, and the reason we are not active screening is a lot of our elementary students, I mean, the importance is asking the questions, right? You know, we're taking temperature, but it's just as important to ask the questions. So, you know, we can depend on some of our younger students to be able to answer those questions. So that was our determining factor to passive screen, to make sure the parents are getting into the Infinite Campus, filling out that questionnaire, asking the questions before they're sending their kids to the bus or school. So with that, I'll turn it over.
Will one of our public health partners be willing to kind of talk about how this has worked elsewhere that they've seen?
Hey, Chris, do you want to take that since you've been since you're the chief medical officer for several counties?
Sure. If you look at the national data and you look at passive versus active screening, I don't want to say that temperatures are not perfect, but they aren't. We don't find, although we're doing it in businesses and in communities and schools, it's not a single indicator of whether or not you are infected or not. So I believe that the passive screening, and you looked at multiple schools, they found it effective at multiple, and not only in this country, but in other countries as well, to say that asking those basic questions that Rob alluded to earlier, that will identify the majority of kids who potentially need to be excluded from school and sick. A one-time temperature or active screen is not that useful. So I do think that this passive screening is the best strategy. And maybe I'll ask Kathleen to answer that, or add to that answer as well.
I would just popped in my head. I just was recalling seeing an article that a lot of the international air travel is actually doing away with the temperature screening as well. And as Dr. Urbina shared, it's one point we look at. And as I shared earlier, we know that about 50%, kind of varies. Of cases may not have a fever. So it's so critical to just have that parent involved in, and as Stephanie shared earlier, what's normal, what's a new symptom versus, what's kind of what we typically see. And so we feel very confident in the passive screening, in that we're expecting, again, trying to really reiterate to parents and to staff as well, do not come to school if you are sick. And so that's really the key takeaway. And then we've also heard on the other side of the spectrum, thermometers malfunctioning, not properly reading when it's cold out. And that's definitely not what we want to have happen either. We don't want students or staff standing outside in queuing up, especially in cold weather. So there's a lot of pluses to the passive screening that we're very confident in.
Can I add to that, Randy?
Of course, Stephanie, please.
I want to, just also remind folks that, again, like Dr. Urbina, and we've mentioned over and over, this really is a layered approach. So we want home to be the first place. We really want folks to think about it at home before they either leave for work or before they send their kiddo off to school. And then, if they're riding the bus or something else, we know that our bus drivers will alert somebody if the child seems sick on the bus. When they get to school, they have a lot of eyes on them. And as a teacher or another staff person in the school, that's another thing that we ask of you. And you do it all the time anyways. If you have a sick kiddo in your class, or you see a child in the hallway that doesn't look like they're feeling well, then direct them down to the health room. And that's where we'll do another assessment, and we'll send them home if they need to be sent home. Sometimes you wake up and you're fine, and then 15, 20 minutes later, or an hour later, you start to feel terrible. So even that screening before school is not the end all be all, right? This is a constant review, a constant monitoring of everybody that's in our buildings. And we have those protocols in place to be able to put those folks in an area away from everybody else and then get them home nice and fast.
Awesome. Thank you for that, Stephanie. I will mention that communications will be sending out messaging to parents on a daily basis, encouraging them to do the passive screening. And it has, worked rather well for athletics. They were kind of a test case for this. And they did run into issues with kids getting scanned outside, being too hot because they were just coming out of the sun and that kind of thing. I'll just mention that as an aside. Speaking of that system, Andrew Moore, our Chief Information Officer, has joined us as well. And one of the things that has been asked by a teacher is the idea of, how will we know that children have done the passive screening in the morning? So I know that the information is coming into IC. Andrew, can you share a little bit more on where we stand with that?
Yeah, happy to, Randy. Good morning, everyone. There is a new report that will go live today in Infinite Campus. That report is available for teachers under the customs report section, and it will show which students have done the passive screening and the results. So that should make it easy for the teachers to see exactly what is happening in their classrooms.
Excellent. Thank you, Andrew. Another question for you all. I've got you. How do we disinfect Chromebooks?
So there are disinfecting wipes that have been sent to every school that are made for the electronic devices. But we should also just be reminded that we have stopped sharing Chromebooks. Each student should have their own at this point. If you do not, please contact the IT service desk at 720-561-HELP, and we'll make sure that we get a device for your student.
Awesome. Thank you, Andrew.
And Randy,
go ahead.
Just a gentle reminder, washing your hands is the single most important factor that you should be doing before you use anything, before and after. And it's very simple to use: soap and water, 20 seconds, or use an alcohol rep. And I know the schools have lots of cleaning instruments around. So I think it's just probably more important to wash your hands than it is to be disinfecting the books. So the Chromebooks, excuse me.
Thank you. Thank you so much. A question that we've gotten a lot on is another area is the idea of the testing. When are we going to make testing a safe part of the return to school? That was from a Fairview teacher. The idea of, how often the teachers are able to take the test. Mike Rados, do you want to talk a little bit about, we're just standing up our own testing now. The community, our public health partners also have testing in the community that maybe they can talk about, but we'll start with Mike.
Yes, thank you, Randy. Good morning, everybody. Yes, we have actually sent out a communication last Friday, I believe, on the logistics of COVID testing with the Gary community. So we'll continue to do that starting today. So if you got the letter, you'll have the link on the letter where you can actually register to go get tested at the sites, which are listed in the letter as well. You can go and get tested once a month. You can go and get tested twice a month. And the results they're telling us the results would be in within 72 hours. So, and eventually, I know the sites are not on any of our campuses right now, but the goal is that we will have that. The closest is probably Longmont at the Innovation Center at St. Vrain Valley School District, and the others are in Westminster and of course in Golden. But I think people that live near in Boulder County will probably travel to Longmont, but that site will be announced at a later time, our own site.
And before we have our health partners talk about their testing, two other quick questions on that. One is, just feedback in regards to the closeness. I know that that's something that we're definitely looking at, obviously, but currently those are the places that the tests are available, currently set up. But Mike, one of the other questions that came in was, so it looks like we're no longer able to test, access the testing bi-weekly. Is this true?
Well, what we have with our contract is that we're testing monthly, that we're guaranteeing so many tests per month, but it doesn't mean that you can go get tested twice in a month if you want. So.
And again, we definitely want folks that that are concerned if they have a contact or have symptoms, certainly to get tested.
I might mention also the reason that the testing sites are put in place for us, so it gives us a record of who our employees are being tested. So in case there is a positive case, we can then start tracing. There are other sites, if you feel comfortable, you can, if you're symptomatic, you could go to your insurance company. That's a preventive measure where they can be tested. Also, Stasio Fields in Boulder are also testing. It's a free test as well. So mention that.
Again, our public health partners do have community testing. Anything that you guys want to mention on that?
Just that there's two testing sites. They are free. One is at Stasio Ball Fields and the other one is up on the hill and it's a walk up. The one at Stasio is a drive up. And we set the walk up so it could provide easy access for students. We want as many off-campus students to get tested as possible. Those sites are continuing, and part of the criteria for the sites is what the positivity rates look like as we're testing. So we will be continuing those sites for the short term at least.
Helene, anything that you want to add from Broomfield?
Sure. So we definitely like to recommend a lot of the different community testing sites. So I know Boulder and Broomfield both have information on our website. So as already shared, going through your provider is definitely an option. There's also locations that just do testing. So Waterworld is still currently testing, and they test children and adults. We also utilize Walgreens a lot. A lot of these sites have online sign up, and it's very easy. It's a very quick process. They do a great job of quick turnaround. And there's the Pepsi Center is going to be closing at the end of the month. That's been another option in terms of, but there's other community testing in Broomfield Public Health for Broomfield residents. We also do a community testing on Tuesday afternoons from 2 to 6, and that's in the Health and Human Services parking lot, and that's for symptomatic individuals. And I just wanted to share in terms of just thinking about if you feel like you're concerned that you were exposed to someone, one important piece is to think about, ideally trying to wait about 7 days, at least 7 days, not sooner, in terms of that exposure, because sometimes we start the case investigation and somebody finds out that they may have been a contact, and so they're part of quarantine, and then they want to immediately go out for testing. And so we don't want people to have that false sense of, oh, I got a negative. That negative does not release you from quarantine. So that's the first thing. If you're under quarantine, that's 14 days. Nothing changes that in terms of a negative test. A doctor's note does not release you from quarantine. But also we also want to be careful that people don't get tested too soon, because the test may not have picked up that viral load yet. So that's where we say at least 7 days after exposure. but there are a lot of different options. A lot of urgent cares are doing testing. There's so much better testing access now than there was in the spring. So we just want everyone to know that there's definitely options out there.
Thank you to everybody for the answer on that. I'm going to ask one last question. I'm trying to honor our time. I know we started a couple minutes late, and I know folks had probably got to go off to other meetings and that kind of thing. One of the key ones that I wanted to make sure that we didn't miss was the idea of personal protective gear. Here in BBSD, we have issued essential protective gear, which includes masks and face shields and some equipment in the classroom. Rob Price or anybody able to sort of talk about what's been issued out and the process around that?
Yeah, Randy, every employee should have gotten 3 cotton masks. If you haven't, let us know. We've also provided face shields. They're not mandatory. They're completely voluntary if an employee would like to wear those. We've also provided plexiglass partitions for every classroom. And the idea there would be is if you can't maintain that 6 foot of social distancing, so when you're thinking of individual instruction and you need to be close to the students, those are good to stop the droplets, but not necessarily the aerosol. And that's something new that came out. We ordered those back in June. But I do want to make sure that is very clear is studies have recently shown that the aerosol will just go right around those, but they will stop the droplets between the 2 individuals. And I keep talking about, hand sanitizer for every classroom. We do have gloves and gowns for nursing staff. I'm probably missing something, but there's been a significant amount that has been sent out to the schools, cleaning supplies, et cetera, that have been distributed. If you think we're missing something, please let us know.
And I'll just Sam Messier has actually created a podcast this week, and its topic is about cleaning. Sam, do you want to just mention real quick, very briefly, kind of what you cover there?
Yeah, thanks, Randy. So first episode of I Heard It From Sam is out today. You can see it in the email, the link to it in the email that Randy sent. So I talk a little bit about the EPA list for approved chemicals for disinfecting and cleaning. And then I had a great conversation with one of our head custodians, Rick Berry, over at Douglas Elementary about the things that he's been doing all summer to keep the school clean while we have school-age care there. And then I talked a little bit with Molly McLaughlin about our district-wide protocols for cleaning and disinfecting. So some good information about how we're keeping things clean for folks and what teachers can do to help out on that front.
Awesome. Thank you for doing that, Sam. We really appreciate it. I know that we are, oh, sorry, Helene, go ahead.
I just wanted to add a little bit more to this topic because I feel like I fielded a lot of these questions. And so I just want staff and teachers to know that we do not recommend people wearing gloves all the time. There's no need for wearing a gown. That's not something that, that's something we need for our hospitals, for our medical workers. We do not wear gloves all the time. I just want you to know that, again, it's the hand washing that's so important. And it gives that false sense of security that you have gloves on. You're actually often touching things more and sometimes less careful. So washing your hands, using that hand sanitizer, the mask is so critical. So again, not coming to work if you're sick and wearing a mask is what's so critical. And then I just wanted to share just as a tip in terms of those of you that utilize the face shields, just be careful with what you're cleaning that off with and washing. A lot of times just soap and water is really sufficient. Otherwise it will start to kind of cloudy the plastic film, and so that kind of then defeats the purpose of it being useful. So just being mindful when and if you're using the face shield, what cleaning you're using that with.
Perfect, thank you. Before I kind of close things up here, Rob Price, since we did talk on cleaning, anything else that you want to add in terms of how that will work in classrooms typically?
No, I think the importance here is cleaning high-touch surfaces, right? So cleaning desktops, doorknobs, anything in that classroom, right? Not sharing materials. We have got a phenomenal custodial staff, but the increased cleaning demand right on them, we're going to have to get help from others. So I know our teachers are going to be helping us out, and that has been communicated in our reintroduction plan. But no, it's really the focus right now, Randy, is on those high-touch surfaces, and then once students and staff are out of the building, doing that increased cleaning at night, like we typically do. So we're using both cleaning and disinfectants that Sam just talked about that are on the approved list. So
Well, all of our panelists were outstanding. I know that we didn't even get to talk to everybody, I believe, that was on the call today. And we did receive about a little bit more than 100 questions. And so we will be working to provide answers on our staff website, staff.bvsd.org, in the next day or so on those questions, especially those that weren't answered. I do typically want to give an opportunity for folks that are on the call to add in one last bit if they had anything that they didn't feel like they got a chance to cover or came up in the call that they just want to sort of whack-a-mole on. And so let's go and start with our public health partners. Helene from Broomfield, anything that you want to add here?
Yeah, this is a great opportunity to be able to share some information, and we continue to learn more. So we will stay in constant contact with the Boulder County Public Health teams, the BVSD teams. We work very closely with Stephanie and numerous other people part of BVSD, and we're happy to contribute to more of these types of morning meetings or town halls just to help answer questions, because really there's just the knowledge is important to know just kind of what we're learning, so to not have any fear driving any decisions. So please follow CDPHE's website on COVID-19 and know that Boulder County Public Health and Broomfield Public Health are here as resources to help.
We are so glad to have you guys as our partners. Jeff Zayak and your team, anything that you want to add?
I just want to add one piece of data that we didn't talk about that maybe there could be a follow-up on later that I know Boulder Valley School District has been very involved in, and that's looking at the schools that have been open and secondary transmission from other schools like Cherry Creek, and there's very positive news there. So in the quarantines that are occurring, there's almost virtually no secondary transmission in students. So that's a positive thing. I just wanted the folks on the phone here to know about and to be aware of. And again, we're looking at all that data, and we'll stay in close contact between the districts and Broomfield, and appreciate the partnership.
Yeah, and I think as he says, the idea that we do see that there are quarantines that schools might have to close because of contacts that have happened as a precautionary measure, but out of those things have not been huge huge increases in actual cases at that point. So I appreciate you bringing that up, Jeff. Any other members of the public health that want to talk?
Yeah, I would just like to add to that too, that we see the same thing locally. So in addition to supporting the school districts, I've also been supporting all of our charters and private schools. And similarly, we have not seen that secondary spread from an initial case. And so that's really promising as we look at reopening. So I think it's important to know, and Randy, you just kind of spoke to this, that we'll see news articles or things on social media saying this entire school shut down, but really that might have been only 2 cases, and just based on the way that students were moving in the building, it was closed for cautionary purposes. But when we look at total cases, it's very low typically. So I think that's just important to keep in mind, and that we have that information locally as well.
Thank you, Heather.
Yeah, just a little bit to that topic too. I'm just sharing that we're very encouraged by that in terms of not seeing that secondary transmission, but to be really careful of when you're going to a wedding or a funeral or a camping group trip, because that's actually where we're seeing the cases coming from. And so again, if someone's sick, they shouldn't be there, and really still utilizing that distance and masks. It's so important in all the other things you do. That's where we're seeing a lot of our cases come from.
That's a great addition, Helene. Anybody else from public health that wants to join in here? Okay, not hearing anybody step up there. Anybody from our team in Boulder Valley that wants to say anything? Mike?
So Randy, one other thing I want to clarify about the testing is an employee can go every 2 weeks. So there's an unlimited amount. So I just want to make sure I speak to that. I didn't want to give anybody the wrong idea. It was once a month. It actually is every 2 weeks.
Okay, great. We'll definitely fix that in communication moving forward. Anyone else?
I just want to say I was visiting a school yesterday, helping teachers get set up to welcome kids back tomorrow morning. And I'm feeling really confident about all of the various protocols that we're layering on top to ensure that we're keeping our kids safe and that we're keeping our staff safe. I think we've got a really good plan, and I'm really excited to have kids back Tuesday.
Thank you, Sam. Anyone else from our team? Okay, not hearing anybody put their hand up or shout out. I just want to once again thank all of our panelists for joining us, and I want to thank all of you for all of your questions. We as a team, are excited to be back together, BBSD, and we'll continue to work to make sure that you have the straightforward information in regards to the situation. I hope you have a great Monday. Thanks.